Hello, I'm Dr. Libia Scheller. I'm the medical director at the Institute of Medical Education and Research, and we are so pleased to have Dr. Charles Ryan, who's the Associate Professor of Clinical Medicine at the University of California in San Francisco. Thank you so much for being here.
My pleasure.
Yeah, one of the most exciting things is I think it's really exciting times for research in prostate cancer and the all the options that males have in for protecting themselves as well. So can you please comment on all the exciting news that's happened here at ASCO, because there's quite a bit of research that's out there.
Right. So it really is an exciting time, Libya, because we have, historically for many years, had a very small list of drugs that work in advanced prostate cancer. So a man who has metastatic disease to his bones or liver or lymph nodes really had very few options in terms of chemotherapy or other approaches. We have, in the last about 2 years, seen a couple of new approaches that have actually gotten to FDA approval, so are becoming standards of care, and we have other drugs that are in the development pipeline but are in the very late stage testing and are likely to become standards of care. So the most exciting things that we're seeing develop over the last few months has been, number one is the development of a second-line chemotherapy with a drug called cabazitaxel, and that was shown a couple of months ago in a presentation to improve survival for patients who have already received frontline chemotherapy with docetaxel. They then went on to receive cabazitaxel, the new drug, and that was shown to improve survival over mitoxantrone, which was a previously widely used chemotherapy.
And that trial was very interesting because in the first line setting you're using a taxane, and then you're continuing also and re-challenging with another taxane. What makes that different?
So it's important in that drug was discovered by testing chemicals against taxane-resistant prostate cancer cell lines in the lab. And so it was found that this one had particular activity, was more potent than docetaxel, and actually caused tumor shrinkage in cells that were actually growing after exposure to docetaxel. And so that led very directly, a direct link between that laboratory experiment and the clinical trial in men who had received docetaxel. So it's a very nice story. It makes a lot of sense. Yes, they are the same class of drugs. That raises some concerns about cumulative toxicity of taxanes in men with prostate cancer over time, but the point remains is that it's a drug that improves survival in a setting in which there's really just no standard of care. Currently, until cabazitaxel is approved and available, there really is no standard of care for men who have already received docetaxel chemotherapy.
Is there any other trials that are presented here at ASCO other than cabazitaxel?
In that setting, there aren't any major trials that are reporting at ASCO now. There are some trials that are open or that are in follow-up phase, and we should expect to see at ASCO in future years or in publications in future years. Most notably, there's 2 drugs that are non-chemotherapies that are being tested in the docetaxel refractory setting or in patients who have already received docetaxel. And the one trial is with abiraterone, a drug that's very active, and the other is with a drug called MDV-3100. Both of these are in phase 3 studies, multi-center international studies, which we should expect to see data from within the next 1 to 2 years.
Can you expound on, as you know, we just had for Provenge FDA approval.
Right.
Can you please describe what Provenge is
Sure.
and how it works, and also what the results of that data were that it gleaned to get FDA approval?
Right, so Provenge is an entirely novel way of treating a solid tumor. It's a vaccine, but it's not a vaccine in sort of the classic sense that we think of vaccines. It is a cellular-based vaccine where the patient actually has part of his immune system essentially removed. It is stimulated against the cancer outside of his body and then reinfused. So the patient undergoes a procedure called leukapheresis where they have about 250 cc's of blood, so about the size of a can of soda, of blood taken out. It's stimulated outside of their body against prostatic acid phosphatase. So that's the antigen. And then after about 48 hours of that co-incubation, the cells are put back into the patient. And that procedure is done 3 times, about 14 days apart. And that's it. It's not a continual therapy like we think of with chemotherapy or other approaches. And so what the exciting thing is that that's a very non-toxic way to treat a cancer patient. There are relatively few side effects. The patients do have some mild side effects when the cells are reinfused into their system. Maybe some people get low-grade fevers, some chills, that type of thing. but no persistent long-term side effects that we know of. And even with just those 3 treatments, when compared to placebo, in patients with metastatic hormone-refractory prostate cancer who were relatively asymptomatic, so these weren't patients with lots of pain, in that setting, the survival was improved by about 30%. And so that suggests that if we can, with either Provenge or other immune approaches, if we can harness the immune system against the prostate cancer, that we can actually come up with non-toxic ways to improve survival and longevity in these patients.
And this truly is a different way to look at treatment in prostate cancer.
Yeah.
And here at ASCO, I think immunotherapies is a big hit.
Yeah.
As you know, ipilimumab was also an immunomodulatory agent that was a positive phase 3 trial. So it's very interesting to see that we're going to management of the immune system.
Right. Ipilimumab is something that we've studied at our institution quite a bit. It's shown some activity in prostate cancer, and I think there's going to be some definitive testing moving forward with ipilimumab. There's another vaccine that's basically a modified virus, similar to poliovirus vaccines, that's being tested to try to stimulate immunity against PSA, and that's shown some very interesting results. And so it is, I think that with the approval of Provenge, this is really not sort of the end of the immunotherapy saga, it's the beginning. And so one can only imagine how we'll be treating prostate cancer 10, 15 years down the road if these approaches continue to be modified and activated against the cancer.
So very top line, what is right now in phase 3 that is next to look at? I know you did mention abiraterone and the MDX, but are there anything else? Those 2 are in phase 3 now? Have they opened to phase 3?
Those are both in phase 3. In fact, the abiraterone is an oral agent. It is a hormonal therapy, and what it does is it blocks androgen synthesis either in the patient's adrenal glands or in the tumor itself. And there have been now several papers over the past several years showing that one of the mechanisms by which prostate cancer progresses is it just becomes very sensitive to very low levels of androgens or of testosterone-like hormones. And so abiraterone blocks the synthesis of these. It's an oral agent. You have to take it with prednisone. But in phase 2 studies, in patients who had already received chemotherapy, for example, about 50% of patients respond to this. And some of these responses are durable, lasting months and even over a year. In the pre-chemotherapy setting, there are high rates of response. Well over 70% of patients have an initial response to it. And in some of the phase 2 studies, and in fact the one that we're reporting here, patients were able to take the drug without progression of their disease for over a year. So that's very exciting, and that's in phase 3. In fact, the first phase 3 study is already fully accrued. We're just waiting for the follow-up to happen to see if it improves overall survival. So that is very exciting. There's a second phase 3 study of that drug that's also being done in patients who have not received docetaxel chemotherapy. MDV-3100 is also an oral agent. It is an oral antagonist of the androgen receptor. And unlike other drugs that already exist that are antagonists of the androgen receptor, like bicalutamide and flutamide, MDV-3100 was developed in a model in which the androgen receptor was already amplified, already overexpressed in these tumor cells that were resisting low levels of testosterone. So again, very exciting drug, high degree of responses in the post-chemotherapy setting, and phase 3 studies underway. The unfortunate thing about men with prostate cancer is that after chemotherapy, the survival rate is pretty low, or the survival duration is fairly low. It's 12 to 15 to 18 months. And so there's a huge need for new therapies in that setting. And it's exciting to see now 3 drugs being tested in that setting.
Yeah, and what's interesting is I think that even though we have great positive phase 3 data that was reported at this meeting and at ASCO with Provenge and the approval of that by the FDA, what's great is we also have other agents on the horizon to keep an eye on. So it's truly exciting times in prostate cancer. So thank you so much
You're welcome.
for all your hard work in prostate cancer and the betterment of patients. So thank you very much.